Hi guys, welcome to Healthy Living with Nosmo, the channel where health finally makes sense. Last week we started talking about uterine fibroids and we looked at what causes uterine fibroid. We looked at complications. We had questions about the symptoms. We had what symptoms, what poses risk factors. We had all of these questions and we were able to answer them to the best of our knowledge. This week we want to look into the treatment options that we have available, and so come with me as I break down the treatment options that we have available to us. Do fibroids need treatment? And if they do, what are they? Now, if the symptoms are mild or you don't have any symptoms, your doctor might just have you be on a watchful waiting, which just means that you don't do anything. You just observe, you do regular checkups, and you observe if there's any symptoms. And if you don't have any symptoms, there's no need to do anything at that time, which is what mostly happens as before we get to that reproductive age or before you get pregnant with fibroids, right? In my case, they saw the fibroids, it was there, but what did we do? A watchful waiting. And as long as it's not affecting your activities of daily living, okay, you're able to do things normally and regularly, then they just have you do a watchful waiting. Which treatments can include medications, hormonal medication, for medications, the medications are to manage the symptoms. It's not a cure to fibroids, it's only to manage symptoms. Okay, then we have hormone based medications and they're called agonists or antagonists. Okay, the hormone antagonist or hormone agonist. And in every one of these medications, estrogen and progesterone are very important. Okay, there's always still a low dose of those given with those medications. Now, it can help to shrink the fibroid a little bit, okay, and help control the bleeding, but it's not a cure, okay. Again, they're controlling the symptoms, but they're not curing it. They're shrinking the fibroids, they're controlling the bleeding, but again, it doesn't completely take away the fibroids. That's one thing we must realize with taking medications for fibroids. Now, the agonist hormone puts you in a temporary menopause state. It puts the body in a temporary menopause state. So if you decide to go with those type of medications, you would have menopause symptoms, okay, hot flashes. Okay, it's possible that you have all those. Okay, as a result, the menstruation will stop, the fibroids will shrink, and bleeding will reduce. Okay, okay, that's what the agonist hormones will do. The agonist hormone will give you menopause like symptoms. The menstruation will stop, fibroids will shrink, and the bleeding will stop. Okay, so that's what that agonist hormone is about. And many people have flashes while on this kind of hormone. Okay, when they're on this type of hormone, they have hot flashes because again, that's a menopause-like symptom. Okay, these medications are not to be taken more than 6 months. Now, in the event where they're taking it more than 6 months, they have to have it in combination with a low dose estrogen and progesterone, and then you can take that medication for at least you can take it for longer than 6 months to 12 months. The long-term use of this medication can cause bone loss, and that's why it should not be taken more than 6 months. In the event that it needs to be taken more than 6 months, a low dose of estrogen and progesterone will be added to that medication for you. Okay, so that's one of the options that you have. You can take hormonal medications. The second hormonal medication is the first one is an agonist, right? This is an antagonist. This is an antagonist. They are used to treat heavy menstrual bleeding. Again, we are treating the symptoms, treating menstrual bleeding in people with uterine fibroids who haven't gotten to menopause, who do not want their period to stop. Okay, the first one, the agonist medication, it will stop your period and put you in a menopause like state. Now, the second one, which is an antagonist hormone that you would take for the fibroids, is going to stop the bleeding. It doesn't stop your menstrual flow. It doesn't put you in a menopause state. The antagonist does not shrink the fibroids. They can be used for up to 2 years. Okay. And sometimes they already have that low dose of estrogen and progesterone in them, or they can add on to it as well. So again, let's go back to it. We can take medications, hormonal medications. We have the agonist. Like I said, I'll always give you simple education without the medical jargon. So I'm not going to go into the name as big as it is, but if you're going to speak to your doctor, you can always ask that what are the hormonal medications that you can take? There's one that puts you in a menopause-like state, and there's one that doesn't put you in a menopause-like state. Okay. The one in the menopause-like state will stop your period and shrink the fibroids and stop the bleeding. The one that doesn't put you in the menopause like state will reduce the bleeding, will stop the bleeding. Okay, it will reduce that bleeding in people who have fibroids, but it does not shrink the fibroids. We also have non-hormonal medications. Those can be used to treat heavy menstrual periods as well. We also have low dose birth control pills. We have IUDs that can be taken. Now, the low dose birth control pills can help the menstrual bleeding as well. Because if you notice that these treatments are treating the menstrual bleeding, and once you're able to retrieve, because what's causing that menstrual bleeding? The fibroids. And so we want to address the bleeding, okay, to help control the menstrual bleeding, but they do not shrink the fibroids, they do not reduce the size of the fibroids. Okay, so you can ask your doctor for low dose birth control pills. Again, IUD, you can also use IUD, and we do know that those IUD as well can reduce your chances of getting pregnant. So you have to weigh your options, do your findings, get your information, speak to your doctor, and then see what options are available to you, and you can weigh your options and choose from there. Again, you have to know that it really depends on your own specific situation. The location of the fibroid, the size of the fibroid, the numbers of the fibroids, the measurements of the fibroids, all of that determines what you would decide to do in that situation. IUD can relieve heavy bleeding that's caused by fibroids, okay? It only relieves the symptoms, okay? It doesn't shrink the fibroids, okay? It does not make them go away. And like I said, it can prevent pregnancy. So if you're looking to get pregnant, IUD might not be the best way to go. It might not be the right option for you at the time, okay? So that's another option of treatment. We've talked about hormonal medication. We talked about birth control pills or IUD. We've talked about non-hormonal ones. There are also non-hormonal medications that we can use. Make sure you're speaking to your OBGYN and asking about all of these treatments before you decide you want to go into non-invasive or invasive procedures. Under medications, we also have pain relief. Pain relievers are NSAIDs like ibuprofen. We have Aleve, naproxen, Panadol. We have diclofenac. It all depends on whatever medication your doctor decides to prescribe to you based on your own specific situation and maybe underlying conditions that you might have. For some people, they can't take ibuprofen, so they might give them a naproxen. For some people, they can't take diclofenac, so they might give them Panadol. So it really depends. Everything is unique to you and your body. So make sure you're advocating for your body and your health. So your doctor might prescribe an over-the-counter medication for you, okay, and to treat the pain that's associated with fibroids. In my situation, when I was pregnant and I was having contractions in my third trimester, due to fibroids, I was placed on nifedipine, which is supposed to be a blood pressure medication, right, to bring down blood pressure. But also, when it comes to maternal health, they can use nifedipine to reduce and stop contraction at the time. So they put me on like a low dose nifedipine to stop the contraction because the contractions was always every time I step into work and I'm standing for 12 hours, it's contraction. I'm almost ending up in the ER, okay, almost ending up in the emergency room. So it's important that you take pain medications if you're having those type of contractions. If you get pregnant and you have fibroids and you're having contractions, see your doctor. Let them determine what they want to give you to help stop the contraction. Mine was unique to me, and that's why I'm sharing this. So again, those pain relievers do not shrink the fibroids. Also, your doctor may suggest that you take vitamins and iron, to replace the blood that's been lost, okay? Because if you're having heavy menstrual bleeding, it can lead to blood loss. So your doctor might suggest vitamins and iron. for you. Now we've talked about medications, hormonal, non-hormonal medications, bed control pills, low dose bed control pills, IUDs are an option. We also talked about pain relievers, medication that you can take to relieve your pain, okay, with fibroids. Now, non-surgical procedures, no cutting, no no incision or little to no incision at all. We're going to look into that. We have what we call uterine fibroid embolization. Uterine fibroid embolization. That is a non-surgical procedure. Now, the doctor blocks the flow, okay, the flow to the fibroids, the flow of blood to the fibroids. The doctor blocks it so that it can shrink, because again, the blood vessels that are supplying the fibroids are going to make them grow. The hormones are supplying, everything supplying the fibroids is going to make it grow, is going to make it viable, right? But when the doctor blocks the blood flow to the fibroids, it causes it to shrink. This is done through a small tube in the blood vessels, all right? And recovery mode is like 1 to 2 weeks. It's a short recovery, no major surgery. Okay, if you're trying to avoid major surgery, this might be an option. Discuss with your doctor. Okay, remember that they will have to put like a small tube to block the blood flow to the fibroids. Okay, and again, this really depends on how many fibroids you have. All right, location, size, how big it is, how small it all depends. Now, another non-surgical procedure is called an MRI, guided focus ultrasound. This is an imaging. All that MRI that I said is just imaging. So they will use sound waves to hit and destroy the fibroids. Other minimally invasive procedures, okay, that has, again, like I said, no cuts or very small incisions, and they can heal faster and you can have fewer complications. We have what we call radio frequency ablation, and they use heat to destroy the fibroids. And this is just like the MRI guided ultrasound, right? That also uses sound waves to hit the fibroids, but this one they use heat to destroy the fibroids. Now, we also have another procedure called a laparoscopic myectomy. A laparoscopic myectomy, and I want you to forget about all the medical jargon that I'm talking about. I'm just giving the name, but I want you to focus on my explanation of those medical jargon. Okay. The laparoscopic myectomy removes fibroids through small cuts. They can remove the fibroids through small cuts, okay, which keeps the uterus, okay? It's minimal, healing is faster, little incisions, and the recovery period is very short, okay? So they remove those fibroids through small cuts, and that keeps the uterus. Again, if you've not had children and you plan on having children, that might be an option for you, okay, because again, you want to keep your uterus. There is another one called hysteroscopic myectomy. They remove the fibroids through the vagina. There's no cut. There's another one that's called endometrial ablation. Endometrial ablation destroys uterus lining to reduce heavy bleeding. This destroys the uterus lining to reduce heavy bleeding. That is another invasive procedure, minimally invasive procedure. This can be treated without major surgery, as I've explained to you, and I've told you the different types of procedures that are available to us. Okay, the different kind of procedure, they're able to use heat, they're able to remove the uterine lining, they're able to remove the fibroids through your cervix, they're able to remove the fibroids using small cuts. Okay, they are all different types of minimally invasive procedures. Okay, so that's something that you want to discuss with your provider. We're also able to block the flow of blood to the fibroids. Okay, and those are minimally invasive procedure. And remember that these minimally invasive procedures, they are it doesn't mean that fibroids can come back. It's surgery, a more permanent options, and these options might be what will work for you, and so that you can live a bleeding-free, a pain-free life. A myectomy. Myectomy means to remove the fibroids. Okay, to remove the fibroids only. That is myectomy. And what does the doctor do? The doctor goes in and remove the fibroids, but they keep your uterus. And this is best for women who still want to get pregnant. Okay, the one where you don't keep the uterus at all is called hysterectomy. Hysterectomy is where they completely remove the uterus, and that takes away anything that has to do with fibroids. That, and you cannot get pregnant after that. Okay, I mean, unless if it's a miracle, but you can't get pregnant afterwards. So it's important that we understand the options that are available to us. We have medications, hormonal and non-hormonal. We have minimally invasive procedures that can be done. And then we have surgical procedures that where they have to open you up and do the surgery. Okay. So know your options, speak to your doctor. And again, remember that the fibroids is unique to each woman. Okay. The location, the size, the numbers is unique. We've come to the end of series 6, and we've completed the uterine fibroid with series 5 and series 6. Like this video, subscribe and share to create awareness about fibroids, and let's keep talking about it. Let's keep sharing the information that we have. Share this video for someone that you know that's dealing with this. It's not okay for you to have heavy bleeding, longer periods and frequent period, longer lengths of period days and frequent periods with and painful periods as well, that affects your daily life and that's debilitating to your health. So keep sharing, like, subscribe, and I'll see you in my next video.